What's up guys, I hope you're doing okay. I hope you're having a great time. So before I start, I just want to remind you, if you haven't watched the first video and the second one, I highly recommend watching them because it's gonna make things easier for you. Anyway, just a quick reminder. Abortions are defined as the expulsion of a product of conception before the age of fetal viability. They can have multiple etiologies, but in about 50% of cases, the exact cause remains unknown, which makes the diagnosis and management more complex. Well, first trimester metorrhagia, meaning bleeding in the first trimester, is often the main symptom, sometimes accompanied by pelvic pain. And the first line examination to confirm the diagnosis is a pelvic ultrasound. It's very important. The treatment of abortions depend very much on the clinical form, severity of situation, and the patient's medical history. Hospitalization is often necessary, particularly if the abortion presents a risk to the patient or if close monitoring is important or required. Biological tests such as complete blood count or CBC and blood typing are performed usually to assess the general condition and the risk of complication, as well as the possibility of a transfusion. In cases of RH negative pregnancy, an anti-D methylprednisolone injection is administered to prevent alloimmunization, thus avoiding complications in the future pregnancies. And if instrumental procedures are necessary for the evacuation, antibiotics may be given to prevent any infections. Well, we have surgical evacuation and medical evacuation. Surgical evacuation can be performed by aspiration or vacuum aspiration or by curettage, depending on the gestational age and the residual products in the uterus, while medical evacuation consists of administering medications such as prostaglandin, which induce uterine contractions, or mifepristone, which blocks the action of progesterone and promotes the expulsion of conception products. Sometimes conservative treatment is used, especially for patients with moderate symptoms or when evacuation is not yet necessary. It includes rest, sexual abstinence, and antispasmodic medication to relieve pelvic pain and uterine contraction. And finally, progestin. If the abortion is linked to a specific cause, such as an infection, in this case antibiotics will be prescribed. Or if it is linked to cervico-isthmic incompetence, cerclage can be performed to support the cervix and prevent premature abortion in future pregnancies, etc. The treatment indications vary depending on the type of abortion and the stage of pregnancy. In the case of a threatened abortion, conservative treatment is often recommended, accompanied by close monitoring. This approach aims to allow the pregnancy to continue under the best possible conditions while carefully observing the evolution of clinical signs. In case of abortion in progress and the pregnancy is less than 8 weeks of amenorrhea, an expectant approach is often considered. The goal here is to wait for spontaneous expulsion with regular clinical follow-up. And if the pregnancy is more than 8 weeks, surgical or medical evacuation becomes necessary. And in the case of an incomplete abortion, as well as for a missed miscarriage, evacuation is systematically recommended. This evacuation helps prevent the risk of infection and other complications, such as uterine synecia. Finally, after an abortion, close follow-up is very essential to assess the patient's recovery and overall health status. An anatomopathological examination of the expelled product is performed to look for any structural or chromosomal abnormalities. A cytogenic study may also be carried out to analyze genetic causes of the abortion, particularly in cases of unexplained fetal death. Also, a bacteriological study to look for any infection that may have contributed to the abortion. And a post-interventional pelvic ultrasound is conducted to ensure that there are no retained products in the uterus and that the organ has properly healed after evacuation. And if the patient has experienced multiple recurrent spontaneous abortions, meaning more than 3 consecutive miscarriages, a complete etiological workup is very essential in such cases. This comprehensive assessment helps identify the exact underlying cause of the abortion. Well, I hope this information and these videos are helpful to you. Thank you so much for watching till the end, and I hope to see you in the next video. Have a good day. Bye bye.